simple. I'm just here to talk on what can happen to your eye when you have diabetes. And the main place that gets affected in the eye is the retina. So let's just go through what the eye looks like. You have all gone through this in school before. Basically, the eye is a round ball. It's like a camera. The front of the eye is the camera and the back is the film. So if something goes wrong in the front, the camera part, that's when you get glasses or you have cataract surgery. But when something goes wrong at the back of the eye, which is like the film of the camera, it's usually very difficult to treat. And that's what I'm here to talk about, because diabetes mainly affects the back of the eye called the retina, and that is diabetic retinopathy. So this is a normal photo of the retina. It looks very nice with all the blood vessels going from the round structure in the center, which is called the optic nerve, and this is a normal retina. So what are some things that can happen to your eyes if you have diabetes? Commonly you can get dry eyes. Okay, a lot of contact lens wearers get that, but diabetics get it more often. They feel gritty and some burning sensation in the eye. That's not dangerous, but it can be uncomfortable. Then you can get lid infections like styes or swelling on your eyelid that needs to be treated with antibiotics, more common in diabetics. Of course, sometimes you have blurring of vision when your blood sugar is high. And some people first know that they have diabetes when they have blurring of vision and they go and check with the doctor and find out that they have diabetes. Cataracts and glaucoma you will hear about in other talks. And I just want to focus on diabetic retinopathy, which is damage to the retina due to diabetes. Now when you see an eye doctor or when you have your checkups, what normally is done is you're asked to read a chart. This is your visual acuity, and then we check your eye pressure. But that is not enough to check your retina, because that's just checking the front of your eye. Now what's important is to look into the back of your eye, and we usually put some drops in to dilate the pupils and look at the retina. So you can see the photo at the bottom, pupil is dilated. That's how we look into the retina. And these are different ways which you can look at the retina. The first three are done by doctors, but you can look at the photo at the bottom. You can actually take photographs of the retina, which is done here as well, and we can look at the structures and see if there's any abnormality, especially for screening of people with diabetes. Now, people with diabetes are increased risk for eye problems. A lot of people know they can get kidney failure, they can have their legs, problems with infections in the legs, sometimes even amputation, but they may not be aware that they can have eye problems. But now there are lots of new treatments, and it's very important to detect this condition very early. So what are the symptoms? The first point that everyone should know is there can be no symptoms, and that's why it's very dangerous, because the person can feel perfectly normal, their vision is perfectly clear, but they may already have problems happening at the back of the eye in the retina. You can have gradual or sudden blurring, and you can see floaters or web-like spots in the visual field, and problems in reading books or even signboards, even while wearing the glasses. Of course, if you don't wear the glasses, you can't see clearly. It might be just a refractive error, but if you wear the glasses and you still can't see clearly, think of diabetic retinopathy if you have diabetes. The lines may appear crooked, and when you want to check with the doctor, you first want to ask, am I at risk for diabetic retinopathy? First question is, how long have you had diabetes? The longer you have diabetes, almost certainly you will have some form of retinopathy, because almost 90% of people who have diabetes more than 10 years will have some form of retinopathy. Secondly is, how's your blood sugar control? If your blood sugar is very high, even if you have diabetes for just 1 or 2 years, the damage can already happen. Thirdly, the blood pressure control also is important, because usually people who have diabetes have high blood pressure as well. Then, do you have any kidney damage? Because kidneys, when they get damaged, usually the eyes also get damaged together. So when you see your doctor for diabetes, if they tell you there's some kidney damage, make sure you ask to have your eyes checked as well. If you're pregnant, nowadays more and more younger people are getting diabetes. So at a very young age, when they have diabetes and then they are pregnant, something because of the hormone changes that occur during pregnancy. And of course, smokers, because smoking can damage blood vessels and cause damage in the back of the eye as well. If the blood counts are low, you also can get retinopathy. That means you have very low oxygen carrying capacity in your body because your blood count is low, you're very anemic. But the important message is if you can keep your blood sugar level closer to normal for a long time, you're less likely to have this damage to the retina called retinopathy. So why is it so important to check your retina if you have diabetes? Because once you have visual loss, it's very difficult to go back to normal. And this visual loss sometimes can even lead to blindness. The two things that cause visual loss is swelling in the center of the retina, we call that macular edema, or sometimes you can even get bleeding in the eye cavity called hemorrhage. The symptoms of the swelling are distortion of vision, where things look crooked or blur. Now this is an example of a normal scenery, but when you look at the picture on the left, you can see all the trees on the side here, they look very crooked. Okay, all the trees look crooked, and if someone is not aware, they may not be realizing that this is an early sign of diabetic retinopathy. And that symptom is described as a distorted vision, and it's an important symptom to be aware of. This is a normal lamppost. It looks very nice. Now, if someone has distorted vision, they will actually see the lamppost looking crooked, and this is also a symptom of distorted vision which can be caused by diabetic retinopathy, which is one of the causes. Why does it happen, this problem in the retina? Basically, diabetes affects all your blood vessels, and your blood vessels in the eye is the only place where you can see it. All the other places, they are covered with other organs, but in the eye, we can look and see what's happening to the blood vessels. So the blood vessels can either get blocked, and then you get lack of oxygen, or they just become very leaky, and everything like a burst pipe leaks out from these blood vessels. So this shows everything leaking out of the blood vessels, and you see the white dots are all water, and the yellow dots are all the contents inside the blood vessel. Now this is a photograph of a normal retina, which I showed you earlier, and you can see on the left, there's a lot of yellow dots in the center, which is actually things that are leaking out of the blood vessel that are causing a reduction in your vision. The person can't see clearly because of that. Now we detect this swelling with a special machine called a OCT, which is available in eye centers. So this machine is a simple test. You put your chin on the machine, and the machine will take a photograph, a very high-resolution photograph of the center of your retina, and it gives a cross-section of whether there's swelling or not. So this is what swelling looks like. You see on the top, it looks like a mountain, and that's swelling which causes poor vision. And the bottom, there's no swelling, that's normal, and the patient will have normal vision. The second cause of problems in vision is bleeding into the eye, what we call hemorrhage. And the symptom can be a floater, where they see a lot of things floating, blurring or patches in the field of vision. This is a normal scene, okay, a very nice picture. Now if you have bleeding into the back of the eye, this is what it will look like. There will be a lot of patches, and that patch will actually disturb. It can look like a shower of raindrops in front of your eye, and that is very dangerous. Why does that shower happen? Why do those patches happen? Actually, when you have diabetes, especially for a long time, there are a lot of funny blood vessels that grow at the back of your eye, and all these funny blood vessels, they actually cause some bleeding. And you can see here there's a small patch of bleeding, and that is what gives these little patches in your visual field. If you don't come and see the doctor fast, and you think that, okay, let's wait maybe 1 week, let it see whether it gets better, it can be quite disastrous, because it can actually go on to bleed like this, and then the vision stops. So that's why it's very important to check your eyes if you have diabetes, because we can prevent the photo on the left from happening if you check your eyes regularly. And of course, lastly, there's so much blood, and we don't want this to happen, and it can be prevented if we check our actually reduce visual loss by about 50%, but it must be done in the early stage. Again, why we need to check our eyes regularly. Sometimes you can do some injections into the eye, okay, and there are different medicines that can be given. The purpose is to reduce the swelling and to prevent your visual loss, and also to reduce the bleeding in the eye cavity. If all fails and still the person presents very late, sometimes we have to do a special surgery called vitrectomy, which is a very complicated surgery done by only specialized doctors. Not all eye doctors can do it, and this is what it looks like when we go into the back of the eye and clear up the blood. Okay, so this, we don't want this stage to happen to anyone because it can be prevented. So the sooner retinopathy is diagnosed, the more likely treatment will be successful, and the best results occur when sight is normal. So you can have problems, but your sight will still be normal. So there's a schedule for eye examination for all people with diabetes. Type 1 diabetes means children. Okay, there can be children who have diabetes. So we check their eyes usually within 5 years of diagnosis, and every year they must come for a checkup. The same for adults who have diabetes, what we call type 2. Those are what we all know as normal diabetic people. They have to check their eyes at least once a year, even if it's normal. And if you're a person who's diabetic and pregnant, you have to check your eyes every 3 months. So it's more often compared to other people. So when you go and see the doctor, ask your doctor, firstly, do I have retinopathy? Because they might talk about cataract or glaucoma. Especially ask them for retinopathy. How often do I need to come for checkup? Minimum is once a year. Sometimes it might be every 3 or 4 months or 6 months if there already is a problem. And if you need treatment, you need to ask them, what can I expect after the treatment? Contact your doctor immediately, okay, within the next day if you have floaters or blurred vision and you are diabetic. And remember to reduce your risk of visual loss by managing your blood sugar well, keeping your blood pressure and cholesterol under control, ensure you examine your eyes every year, stop smoking, and of course pay attention to your vision changes. Diabetic retinopathy is a teamwork, so it might be your diabetic doctor or your optometrist who asks you to go for a checkup. And even though you may feel there's no problem with your eye, that you see very clearly, remember that we have to prevent blindness and check your eyes, even if you feel it is normal. Thank you.
Thank you very much, Dr. Tara. Very good. It's very in-depth talk on diabetic retinopathy. Now, for those of you who are still here, our activities have not ended. I mean, those were just the talks. We'll be having a lot more activities in a while more. In a short while, the transitions group will be doing a Q&A session, and those of you who are able to answer the questions will be given free vouchers to take back, and if you want, you can actually spend the vouchers on the spot buying any of the products that we have here. Alright, all this is in conjunction with World Sight Day happening here at Survey Pyramid at the Orange Corner.